Good afternoon, and welcome to our inaugural Conversations with the LifeRaft Group. My name is Diana Nieves, and I am the Senior Director of Outreach and Engagement here at the LifeRaft Group, and I will be your moderator for today's conversation. Today, I have the honor of introducing the LifeRaft Group's Executive Director, Norman Scherzer, who will be speaking to us on the timely topic of coping with COVID-19. As founder and executive director of the LRG, Norman leverages his extensive experience in the communicable disease sector, which included 25 years at the Center for Disease Control, and from his position as Assistant Commissioner of Health for New York City to help cancer patients both survive and thrive. After Norman's talk, we will accept questions from the audience, which I will moderate. You can ask questions in the Ask Questions box to the left at the top on a cell phone. If you are on a cell phone or tablet, you might need to click the play button. Allow me to turn it over to Norman.
Thanks, Diana. First, the usual caveat. I'm not a doctor, and nothing we say is a substitute for talking to your doctor. But I thought I could give some background on what's going on. One other caveat is that we haven't had a pandemic like this since 1918. And every day you hear news, some of it right, some of it wrong. We're still learning about this particular virus. Originally it's called the coronavirus. Now it's called COVID-19. But I thought I'd start by talking a little bit about how do germs spread? What happens? And if you picture yourself sitting across the table from each other, and you took a tiny little piece of paper, maybe the size of a little bit bigger than the end of your pen, and you tried to throw it across the table to somebody sitting 6 feet away, it wouldn't reach them. So the interesting thing about this virus or any other virus is viruses need our help in order to spread. They don't have feet, and they don't have wings. And in a little while, I'm going to ask Jerry just to chime in a bit based upon some of his experience in a very interesting profession, working with radiation as well. We think that this particular virus originally started in some sort of a wild animal. We think it started in China. It was probably a bat. No one's going to actually really be able to prove it. But what happened was originally the virus went from an animal to man. So far, not so good, but not so bad. And then it mutated and it went from man to man. And that became the coronavirus epidemic. Every year, in contrast to flu, what happens every year is flu changes from year to year. And every year, the vaccine that we manufacture in the United States for influenza is based upon our observing what took place in Latin America the year before, because Latin America's seasons are the reverse of the ones in the United States. Then we adopt the vaccine, and what happens during the normal flu season is many people already have some sort of immunity to that particular flu virus because they experienced it the year before. Add a vaccine on top of it, and we manage to get through the flu season with damage, but not quite as much as we're experiencing now. So what's happening right now is kind of like the perfect storm. First of all, we don't have any prior immunity to this particular virus. It is a brand new virus. Second, we don't have a vaccine. And we're unlikely to have a vaccine for some time to come. Best estimates are, if we're really fortunate, that maybe we'll have a vaccine in 9 months, 10 months. Some people predict 12 months. The virus, unfortunately, can spread before people have symptoms. And that makes it a particular problem because you don't realize you have the disease and you're in contact with other people. Unfortunately, the early cases that are coming in, report that are coming in now from CDC, seems to indicate that it may be possible that even after you get through this virus and feel totally better, that you might be infectious for a couple of weeks afterwards. And it's very difficult when people are spreading a virus and they have no symptoms. The reporting has lagged behind. The biggest issue has been a lack of test kits, and the second issue is that we haven't had any particular treatment. Now, there's one particular difference between this virus and other viruses that we've experienced, in addition to the fact that it's brand new, and it is that this virus has a propensity to go directly to the lungs and replicate itself within the lungs. And that makes it particularly dangerous, particularly to people who are older and people who are immunocompromised. Now, the good news that came across the flash from CDC this morning was that Abbott Pharmaceuticals just announced a point-of-cure test that will produce a test result in less than 14 minutes. And that is an amazing breakthrough because the current test results take 2 to 3 days. And it's kind of difficult if you're trying to, sort out, who is infected and who is not. One comment about how this virus is spread: it is an airborne virus, and I think some people have some questions about what that means. It attaches itself to surfaces, and it can live on different surfaces. It has some preferences. Okay, it can live on cardboard. It can live on fabric. It loves plastics and metals. Picture yourself walking into a store, and there is a metal doorknob. Viruses love metal doorknobs or any kind of metal. The virus cannot go through your hand into your body. So the only way you can keep this virus alive is if you take your hand and put it on your face. And one of the toughest things in the world, by the way, is how do you keep your hands off your face? Easier said than done. So the mantra now that we're accumulating in terms of what should you do in order to protect yourself: 1, cough into your elbow. Takes a little bit of practice. Second, bump, don't shake, whether you're bumping with your elbow or with your hip. Third, distance. The typical mantra is 6 feet. Fourth, avoid common surfaces like the ones I was talking about. If you enter a store and you don't have a rubber glove on, carry a paper towel with you and use the paper towel to open and close the door. And then the final thing, obviously, everybody's talking about is wash your hands for 20 seconds. If you want to know what 20 seconds is, sing happy birthday to yourself very, very, very slowly, and we think that will be about 20 seconds. One other comment, and that is that the LifeRev group has been working not only with a lot of patients, but also with a lot of physicians. We're arranging telemedicine consults in a number of cases, and we're also working with several pharmaceutical companies that currently have clinical trials, like Decipher, to keep the trials going. So that's kind of a brief overview, Diana, and I'll let you read out the questions.
Thank you, Norman. First question: do we need to stay home totally and only go out with a mask?
I think if you can stay home, if you're not a nurse and you're not working in an emergency room, I think we ought to all stay home as much as possible. Excuse me, with a couple of exceptions. Obviously, you need food, and so there are limited occasions when you may have to go out for food or for medicine. And it's okay to go out into the fresh air and take a walk as long as you avoid contact with other people. So for the most part, we isolate ourselves, but I think that there are some clear exceptions. Diana?
Next question. Does Gleevec affect...
Diana, before you do, let me ask Jerry Cole to jump in. I forgot. And Jerry,
Sure.
Just talk about your brief introduction about hot zones and cold zones.
Well, before I do, same caveat as Norman. I have no particular expertise in this. I'm just basing this on some past experiences that I've had that there may be some similarities, but there are also some very different things about it. And I am learning as we go along about this, as everyone else is. So this is from a layman's perspective. And that said, I used to work in a nuclear facility, and we did some decontamination work for months on time. And one of the very clear things is that you had separation between what we called cold areas and hot areas. And as you come out of an area that's hot, you have to decontaminate yourself. You know, you have to get rid of things and protect your cold area. So what I would say that this is similar to is think of your home as a cold area. And when you go outside into particularly stores or around other people, you think of these as, even though they may not be hot, but they're potentially, this is where you can pick up contamination. So I tend to think of trying to break this cycle before you bring it home, which is most likely as you're entering your car and while you're in the store. You know, think of things that you're going to touch. You know, if you can wear something like latex gloves, it would be great, because not only are you're able to dispose of those when you leave, but when you're wearing gloves, you may be less likely to touch your face while you're in the stores. But actually, get rid of
I think he's breaking
cleaning
up.
your doorknob if you okay, or cleaning your door handle to your car if you touch that, things like that. So just try to break that cycle before you bring that home, and that's basically it.
Okay, thanks, Jerry. Diana, next question.
Next question. Does Gleevec affect your immune system? Are we more at risk?
Yes. I think anybody who has cancer, anybody who is on a chemotherapy type drug is considered to be at higher risk than people who are not. And add to that many of us are older, and that just adds to the risk. Diana?
Next question. Rumors are swirling on newscasts that spread of the virus may even exist outside during walks as you pass someone on the street, that droplets may linger in the air. Is this true?
Well, it's changing every day. In fact, I just got a flash literally 3 seconds ago, CNN reporting an expert panel saying that the virus can be spread by talking or even breathing, in addition to coughing and sneezing. But I think that there is a reality check to this, and that is when you think of how viruses spread in typical seasons, like in the flu season. It used to be in the old days before we had air conditioners, and now you know how old I am, that viruses were really prevalent during the winter and not so much in the summer. Picture a sunbeam coming through a window, and what you see on that sunbeam, you see millions of little dust particles in there. So what would happen in a typical flu season is somebody would cough in a room, and the virus would cling to those dust particles. That person would leave the room, you enter the room, and you breathe it in. It's similar here. If you're walking into a closed space and somebody has coughed into the air, it's possible that those droplets will linger in the air for a while. Some controversy about masks and no mask. I personally think if you're walking into a closed space like a store, it's helpful to have a mask on. I think the chances of those droplets clinging to the air, if you're walking outside, particularly on a breezy day, are pretty minimal. Could it happen if you're really close to somebody? Yeah. But I think that we're pretty safe. And I invite anybody who comes to my town of Little Falls, give me a call. We have a waterfall with a great path. There's nobody there. And I think that's a pretty safe area. Diana?
Sure. If a patient has an appointment scheduled in the near future, should they still go? Should they call the doctor first?
I would always call, and I think in many cases what's happening, if you have a routine CAT scan schedule, let's say it's your 3-month CAT scan, and you need to put it off for a month or two, I think the risk of doing that is probably less at this moment than the risk of walking into a crowded doctor's office. A lot of this depends upon how that office is set up. More and more medical offices are setting up telemedicine types of of consults where you can call in and they'll talk to you on the phone. Now, obviously, if you have to go in for a CAT scan or for a blood test, you have to be physically present. And I think it depends upon the medical facility. A lot of them are getting better and better at staggering patients, just allowing 1 or 2 patients in at a time. And you need to ask them, are they prepared to take care of a patient right now? Diana.
Should we fear a shortage of imatinib?
I don't think so. But anything is, anything is possible with the current supply lines that are taking place. But we haven't heard anything yet from Novartis or any other pharmaceutical company, for that matter, about shortages of the drugs that we're dealing with. If we do, we'll let you know.
I'm stuck in a city that is not my home. What do you think of me flying home ASAP? I have gloves and an N95 mask.
I think it's a terrible idea. I think that people ought to avoid travel unless it's absolutely necessary. And I think and by the way, I think most travel is being canceled anyway. Now, are there circumstances, excuse me, in which people have to travel? Obviously, but I think if you can avoid it, I would. Diana.
What we are going through now is also new and scary. Are there any other places where we can talk to fellow GIST patients or the LRG about some of our concerns?
Let me ask Pete Knox to answer that question. Pete is the Director of Research for the LifeRef Group.
Absolutely, Norma, thank you. We're still operating our Facebook groups, which honestly are maybe even more important now than ever because it's a place where you can connect. And we're also still operating Just Chat. There's been a lot of conversations about COVID-19 as well as lots of other topics on Just Chat, and that still absolutely remains open for patients and caregivers to discuss any issues.
Okay, thanks, Pete. Diana?
How is the LRG and its staff dealing with COVID-19? Are you still open for business?
We are. We're all working from home, and I must admit that most of it is going pretty seamlessly in terms of using virtual meetings. It's more stressful. It's more tiring. Many of us are going crazy, and our staff, like any other staff, is dealing with a variety of issues. Some people have children at home. Some people, couples are learning the hard way or the easy way. Can we really live together intensely under these circumstances? So all of the stresses that everybody else is going through, we're going through as well. We have 2 or 3 meetings a week with our staff just for a half hour, just to walk around, walk through the staff and say, how are you doing? And people come up with problems. The first meeting we had, somebody said, my grandfather died. I can't go to the funeral. So we're coping with the same problems, I think, than anyone else is, plus keeping the LifeRef group going. And the one other thing I would add is that I have never been more pleased and impressed with the staff as I have with my LifeRef group staff. They have stepped up to this plate incredibly. And it is an honor to work with them. Diana?
If you possibly have the virus and are told to stay home and isolated, as a caregiver, can I still take care of a GIST patient? We live in small quarters.
Well, it depends what the options are. Everything is a question of weighing risks. If I were infected and my partner was a GIST patient, I would want to stay away from that patient as much as possible. If you have no choice, then you have no choice. And so clearly, it's a lot of this advice is easier said than done. We're human, and we have to deal with practical situations. Diana?
What do you recommend we do to deal with the stress from this? Any tips?
Well, every night I have a glass of Johnny Walker Black on the rocks with a a slice of lime, although I must admit that the bottle is almost empty, and I'm half serious and half kidding. I think we all have our own techniques for dealing with stress. I think so. I think there's the practical issues of, how do I get to a doctor? How do I buy food and what have you? But the other stress issue is social isolation. And we would love to hear from people if you want us to set up any kind of other virtual meetings. This one we're not able to see each other face to face, where people can get together and just talk about their stress issues. We have a very diverse staff. We have some of whom have backgrounds in counseling, and we'd be happy to try to help. Diana.
So glad to hear that LRG is still open during this difficult time. Is there anything we as the patient caregiver community can do to help?
Well, you could send a check. I got to tell you that donations are down dramatically, and we still have rent to pay, and so financial support is really helpful. I think you can say a prayer for us every night. I think it is stressful for staff. And I think if you have any particular skills or any particular interest and want to volunteer your time, let us know. We've got a lot of volunteers right now. I know we have a mentor meeting coming up in a few minutes, and we'd love to enroll other people. And we have some unusual members, one of whom happens to be an ER nurse in a major hospital. And what we got from this person is we begin to understand, the reality of what's going on. Share your stories with us. If you've managed to solve a problem to deal with just as a cancer under the circumstances we're going through right now, tell us how you solved that problem. Let us share the story. Diana?
We also appreciate patient registry updates.
Well, let me, yes, we do. Pete, would you like to talk about that?
Yeah, if you're sitting home alone and you're looking to talk to someone, our registry staff is very happy to take your update. Now's a good time to do it. And it's also good to just talk to somebody. So if you want to talk to someone about this, they're very knowledgeable about GIST, obviously. And if you're looking to do an update, this is a grand time to do it.
Thanks, Pete. Diana?
Would you like to share anything else, Norman, or have Jerry to join in and share? And or Pete?
Well, I'll make a comment, and then we'll go around with our staff, and that is we're sending you all a hug. I mean, we have never gone through anything like this before. It is unprecedented. There's a cliche I truly believe in, that we're stronger together. Jerry, would you like to say something?
Yeah, I think we're all learning as we go, and the information is evolving very quickly. So you may be exposed to information that is different from a lot of different sources. So we're glad to give you opinions on things, but like you, we're learning. And let's just all keep our open mind and keep learning together about this.
Thanks, Jerry. Pete?
Well, Norman, I'll echo what you said on GIST Chat, I guess now a few weeks ago, in closing in your letter to the community, that if there's any population out there that can beat this, it is this population who has already fought so hard for against this cancer. So I'm optimistic. Take an opportunity. This is absolutely unprecedented. Remember this when it's over, because it will be over at some point. We will get through this. But just take this opportunity to do the things you didn't have time to do before. Connect with your family. Deal with those hobbies that you didn't have time with, because now we have lots of time more than anything else. But just know that it does have an end.
Okay, and Diana,
we have one more question.
I'm sorry, go ahead.
I'm a caregiver and a blood donor. Do I need to be concerned about going shopping, helping out a friend who also has health issues and needs a ride somewhere, and donating blood?
Well, the easiest part, I think, is donating blood. I think that that the circumstances that blood sites have set up that we know about are pretty extraordinary. It's probably one of the safest places around. I think in terms of contact with anybody, whether it's in a car or what have you, the less contact with strangers, the better. And the more you abide by best practices in terms of distancing, the better as well. If I were picking up a friend in the car, what I would probably do is have him sit in the back and just have. It sounds crazy, but I think that the best weapon that we have right now, short of a vaccine, is social distancing. So the more we can practice it, the better off. Diana?
There are no other questions at this time.
Then Diana, who is both our moderator and the head of a lot of other things in the Life Raft group, including outreach, why don't you say the final word, Diana? What would you like to share?
That it's an important time to connect with the people that we love, and so in whatever way that you can do that, by phone, virtually, or email, texting, and social media. I think those are great ways to just stay connected and uplifted. And there are going to be other resources available and information shared. Our communications department at the Life Raft Group, they are going to be and have been sending out information, important information, to help out during this time. So just stay tuned, stay aware, and stay up to date via our Just Chat, our Facebook pages, and other social media platforms. Thank you.
God bless everybody.
Words, Norman?
Yes, God bless everybody. Stay safe.
Thank you.